Thank you for joining us. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Joining us here on the program today is the Director of Provider Education for ZRT Laboratory, which is located in Beaverton, Oregon. With more than 25 years of experience with bioidentical hormone therapies, both in clinical practice and in retail pharmacy, and as a pharmacy consultant, educator, and educational program developer. He is also on the faculty and a graduate of the Fellowship of Anti-Aging and Functional Medicine. He's going to be joining us here today to talk with us about the benefits of being able to support healthy aging through bioidentical hormone replacement therapy. And I'd like to welcome to our program Jim Paletti. And Jim, thank you for joining us here on the Beyond 50 radio program today.
Well, thank you very much for inviting me, Dan.
Now, let's talk about how supporting healthy aging has changed over the last 30, 40 years, and of course within the last 25 years that you've actually been in this field.
Well, the big change I've seen is people are looking ahead, trying to prevent disease states and problems with their health and trying to stay well and healthy rather than using drugs to treat symptoms after the fact.
Mm-hmm. Very much so. Now, let's talk about bioidentical hormones then. First of all, the importance of what hormones, the role that they play in maintaining a healthy lifestyle.
Absolutely. When I talk hormone restoration, I had explained to people I have two basic goals in mind with any hormone replacement or restoration. The first is to treat the symptoms of menopause or andropause. We have to take care of the hot flashes, the loss of memory, the irritation, the sleep problems, the weight gain, the hair problems, etc. We have to make people comfortable and make them feel like they're not falling apart. But a second very important goal, in my mind, just as probably more important, is the hormones play a very, very important part in regulating all the systems in the body. They are protecting your cardiovascular system. As we are young, they do a very good job. It's just when they become depleted that we lose that protection. They protect us naturally from cancers. They maintain the nervous system. They maintain the memory. They protect and grow our bones. They maintain the function of your skin, your eyes, your teeth. You can't point to any place in the body where the hormones are not playing a part in maintaining that system. My goal is to restore hormone levels to that of a younger individual to continue to provide the same protection that the hormones have done for years.
Mm-hmm. Now, what was it, Jim, that got you moving in this direction and getting away from, the conventional agents that doctors have used for years?
Well, years ago in Beaver Creek, Ohio, I was part owner of a medicine shop that had a compounding lab, and we compounded some special formulas for doctors in the area. And one doctor called me one day, an ear, nose, throat doctor, and said, "Can you do progesterone?" I said, "Certainly can." He says, "Can you do Triest?" I didn't know what it was. I said, "Let me check into that." Well, he started giving me a lot of literature to read that supports bioidentical, and as a pharmacist, I'm really confused because I'm reading these studies, and they contradict what I've learned. And I realized shortly down the road that we weren't exposed to a lot of the literature that's out there in the rest of the world here in the United States in our medical systems. And a lot of this literature said the bioidentical hormones work differently than the conventional hormone replacement. So that got me very interested, and then I had a personal thing happen. I had an aunt who I was close to catch breast cancer and pass away from breast cancer. My other aunt caught breast cancer. Fortunately, she survived it. And my mom was on conventional therapy, which at this time I was convinced was increasing her risk. So I had a personal reason to learn as much as possible. And the more I learned, the more I got developed a passion for let's get the truth out there, and let's let patients and doctors make good, healthy choices as far as hormone replacement.
Now, that's the interesting paradigm that we're beginning to see here, especially as we've been doing the show over the last 5 years, is it almost seems as though doctors have kind of slumbered through and sort of been doing things the way they've always been done and becoming aware that, just laying one drug or one, if you will, medication after another on somebody just isn't being effective. It's almost as though it makes them become more sicker as they treat symptoms. Are you seeing a greater awareness and a greater awakening in the medical community to move in a different direction than the way things have always been done?
Although change is very slow,
yes, it is.
We do, and a typical change in the standard of practice in the field of medicine is at least 10 years. Mm-hmm. Even if we knew and convinced everybody today this is the right way to go, it's going to be 10 years before it becomes standard of practice. But we see a big change. I mean, there is now the fellowship program of anti-aging and functional medicine. They've had in the 3 years they've been in operation over 30,000 doctors graduate or are taking it or have already graduated, and there is now a master's program in functional and metabolic medicine. So it's now in academia and being taught. Functional medicine is where instead of giving you something to treat your symptoms, it's let's find out what's wrong. Let's look at the body as a whole, finding out what's causing, what the underlying causes of your symptoms are, and treat the cause. Along with, let's look in the future and say, what do we do now, nutritional-wise, lifestyle-wise, etc., that can prevent you or at least decrease the risk of your developing certain disease states. And it's a whole different approach. The problem is, in my mind, it's a lot of work. And if I'm a physician, I've just paid hundreds of thousands of dollars for umpteen years of school, and now I have to start all over again. It's kind of like not an easy thing to accept.
Of course not. You know, I also find when you talk about lifestyle changes as well is that you take a look at also how we're looking at the food industry and how our food is grown and raised, and we're taking a look at how that depletes a lot of the things that we have in our body. And then here we have the bioidentical hormone replacement therapy that is changing the way we actually age to support more healthier aging. And you kind of think, yeah, as you said, it truly is a slow process.
It's a slow process, but lifestyle, you know, to do bioidentical hormone restoration, we have to talk about lifestyle, nutrition, exercise, and what you eat first. It all starts there. I can give you bioidentical hormones and try to restore their levels, but they're not going to function correctly if your nutrition is really poor. If you're not exercising, you're not going to make your hormones work efficiently. You're not going to produce the right amount. It's not like you have to go out and become an athlete, you know, but we do have to do some exercise to make the hormones work correctly. So you have to look at the overall picture. The hormones, restoring those, it's not a magic bullet. It's not going to fix everything. There are certain lifestyle changes that make the hormones work much more efficiently.
Mm-hmm. Now tell us, Jim, what are some of the benefits that you try to get with bioidentical hormone restoration?
Well, let's talk about one that really hits hard, more to women than men, because women look at it completely differently than men. Let's talk about weight management. When a woman gains 5 pounds, that is important. And I always explain to female patients, I apologize, because us males, we really don't understand how significant that is to the female. To us, it's 5 pounds. But it's critical when women start gaining weight. It's very bothersome. Well, estrogen and progesterone, for example, both at a physiological level as we're younger, play an important role in regulating release of insulin, uptake of glucose, and regulation of fat storage. If you are deficient in progesterone and or estrogen, you will gain weight. And other than starving yourself to the point of dying, there's nothing you can do to stop that. If your cortisol is running high, you will gain weight. And cortisol being high will lower thyroid function, so it'll add even more weight. So if we want to regulate weight and manage it correctly, we have to establish hormone balance. That's just one factor. If you want cardiovascular protection, what the literature has shown, the best way I can protect women from the number one killer of women over the age of 50, cardiovascular events, is to restore a physiological level of estradiol, progesterone, and testosterone. They work synergistically together. Estradiol alone helps, not the conventional therapies. They increase the risk of stroke. But bioidentical, at a physiological level, increases protection. You add progesterone to it, it works synergistically. They work together for even better protection. You throw testosterone in there at the very, very small level that women have, even more protection. In men, a little bit different. Same thing, got balance of hormones, but with the men, the testosterone plays the most important role in cardiovascular protection, but the other two hormones add to that. So that's just two examples of what I'm trying to do, but it goes on and on in every system of the body. You look at the bones. We all know that any estrogen, conventional or bioidentical, either one, will slow your bone loss. But that's a small part of the picture. As we are aging every day of our life, we have bone remodeling. We lose old bone, we grow new bone, and we make strong bone. Well, in order to do that, it's a lot more than calcium and vitamin D. There's other minerals involved, but most importantly, estrogen will slow bone loss, progesterone will stimulate new bone growth, and testosterone is needed to make the bone strong, make it dense. So you need the three hormones at physiological levels along with the proper minerals if you want to protect yourself from osteoporosis, which, by the way, more people die from causes related to fractures from osteoporosis than die of breast cancer.
Wow.
So we need to protect women from these diseases or disease states that are causing so many fatalities. And the top three are cardiovascular, fractures, osteoporosis, and breast cancer. And breast cancer is a really big one in a lot of people's mind. And what the studies actually show is that the right estrogens, bioidentical, at physiological levels with progesterone and testosterone, which plays an important role in this, those three go together to actually help protect against breast cancer, where conventional therapies, especially the synthetic progesterones, significantly increase the risk of breast cancer. So it's like night and day difference. One is it causes you an increased risk. The other is helping provide the natural protection that you've had in your body. Women had that natural protection right up to perimenopause when the hormones become imbalanced. Again, we just want to restore those hormones to maybe the age of 30 or 35 to continue to provide that natural protection that's been there in their body all along.
Mm-hmm.
You know, when you go on and on.
Yeah, I was going to say, Jim, that when you talk about breast cancer, is it because we're seeing an increase in breast cancer people, that is it due to population size, or is there something else that is making it more rampant, so to speak?
I think there's a lot due to the environment, because if you look at the studies from different populations around the world, there are people over in China and Himalayas, et cetera, that don't have any significant risk of increased breast cancer as women become perimenopausal. What we do here is several things. First of all, we have a lot of environmental estrogens in our pesticides, our xenoestrogens from plastic, et cetera, that we are exposing people to. I see more and more young women, teenagers, having hormone imbalance problems. In almost all cases, it's estrogen dominance, and they're just exposed to too much estrogens. And then we have a lot of toxins in our environment. I mean, girls are putting on makeup and hairspray at, age 6 now? Well, those all have toxins.
Isn't that true?
and they're straining their livers. And if their livers get gunked up, then you don't conjugate your estrogens and eliminate them correctly. So the estrogens you're making the right amount, but you're not eliminating them, so you get buildup of too much, and that causes problems like PMS and other bleeding disorders, et cetera. So we have an environmental concern here that's affecting hormone balance, and I'm seeing it at younger and younger ages.
I was going to mention that, Jim, because it was not too long ago I was in a conversation about health and wellness, and I said, you know what's really got me troubled is that you're seeing a lot of young kids, and we're talking as early as 7, 8 years old, up until their early 20s, complaining about always being tired. And I'm thinking, I don't remember seeing that often even when I was a kid. I mean, you were full of energy until you ran out. And I'm thinking, you just got out of bed. How could you be so tired? And you wonder what's really going on there.
It's our lifestyle and environment. I mean, you've got the situation, if you have too much estrogen, as I just described, you will increase your thyroid-binding globulin, which ties up your free thyroid hormone, so your thyroid won't function correctly. You will be tired. You also have a lifestyle that has an inflammatory diet in so many cases, and that inflammation hurts the gut's absorption of nutrients. So even if you are eating a really good diet, you may not be absorbing the nutrients. But we have high schoolers on the way to high school stopping and get breakfast at McDonald's, and fast food is not good food. I mean, there's no nutrition there, and it's usually inflammatory. So we're pouring fuel on the fire of lifestyle leading to hormonal imbalances. And yes, we're seeing it younger and younger. And the other thing we have is we have stressful lifestyles. Now, there's two people that are extremely stressed: women, middle-aged women, and teenagers. Teenagers because of all the peer pressures now. And you under stress constantly, your cortisol is going to go up. Your cortisol goes up, you will suppress thyroid function. You will gain weight and be tired. Middle-aged women, they're the worst. Women, just when they get to perimenopause, it's my feeling that, first of all, women are just so stressed. We expect them to be, the perfect mother, the perfect spouse. Now, since parents are living older, they also have to be the perfect daughter and take care of mom and or dad. And they have to bring home a good slice of bacon. They're under a lot of stress. Well, now they get to perimenopause. They can't, at work, they can't focus like they used to. They can't remember things. They're irritable. They snap at coworkers. What do? They start worrying about the fact, I can't do my job. I might get fired. They're losing hair and gaining weight. They're worried about how bad they're going to look in another year. They can't remember their kid's first name or where they put the car keys. They're worried they're getting Alzheimer's. You put all that worry together with all that cumulative stress they've had for so many years, being the perfect mother, perfect spouse, etc. It's no wonder most women in perimenopause have an adrenal issue, and that leads to fatigue. Number one symptom of low adrenal is fatigue.
It's just, when you think about all the aspects of what you're just describing of why we're in the physical state that we're in, it makes you wonder if there's any hope or whether doing this in the first place is really going to have any validity. But apparently so, because we can actually prevent, as you talked about, or even protect ourselves from this onslaught of environmental and physiological as well as psychological bombardments that we seem to be hammered with day in and day out.
Well, you don't have to have a perfect lifestyle. You don't have to have perfect elimination of contaminants. What we need to do is work on it. But I've had people that, you take a mild detox tea to detox your liver for a couple of months. It changes them completely. They have so much more energy. You take a good probiotic for a couple of months to reestablish a normal flora and just learn which foods to avoid. And if you're successful at a good amount of it, you don't have to be 100% successful. You will see changes that then enable you to have the energy to cook better, work out better, which everything leads to another, and everybody takes it to whatever degree they want to personally do, but we can improve the way people feel and function on a daily basis. And there's so many options here. I mean, it's so easy, really, to take supplements and support your adrenal function, and, of course, you have to learn how to, respond to your stress a little bit differently, do better that way. But, yeah, there's so many opportunities here in the lifestyle and the hormones to greatly improve the way people feel that it's very encouraging. If you could see all the letters I've received over the years, I wish I'd saved them all, of the typical, thank you. I was doing this early on 25 years ago. I received flowers one day at the store from a male, which I thought was kind of strange, with a little note that says, thank you for giving me back my wife.
Right.
And saving our marriage. And I like to say I've saved a lot of marriages, and I'm proud to say I've gotten a lot of women pregnant by the use of balancing hormones, because a chief cause of infertility in my mind is low progesterone levels, low thyroid function, which can be fixed. These are very rewarding things to do.
I can see how when you get up in the morning enthusiastically that you pretty much are excited about what you're about to help people do in the course of the day. And that's another thing, too, when you talk about lifestyle, is how we tend to go to jobs that we just can't stand going to, but we put ourselves in a position due to bills and debt that make us believe that we have to do that. But that's another lifestyle change that a lot of people can make as well.
A lot of people are trapped in a way, especially with the economy today, but there's a way to deal with that. Everybody has to personally find a way that they can counter that stress. You can't eliminate stressors in your life. You can't get rid of everything you hate. I mean, what's a woman to do? Shoot her husband and give her kids away? What we need to do is we need to learn how we can respond to that stress. And what I teach people to do is, number one, you have to find things in your life. Take a little time for yourself, Mom. You're taking care of the kids, the neighbor's kids, your husband, your mom, everybody except yourself. Take a little time and do something that's relaxing to you, that releases stress. The other thing they have to do is balance the positives in their life. Everybody's blessed to some degree, but we as human beings tend to focus on the things that make us unhappy or worry us. You need to focus on the positive things in your life. I tell people, if you get up and thank the Lord every day for 3 things in your life, you're going to feel a lot better that day.
I totally couldn't agree with you more. That's for sure, Jim. Now, I was going to ask you now, getting back to biohormone replacement therapy, first of all, how does a person find out whether or not they need to have this therapy, and what hormones are typically involved when they do?
All right, well, it's different for men and women, but first of all, you look at your symptoms. And the best way to do that is you need to find somebody who's got some experience in this. Like if you went to the ZRT lab, salivatest.com, went to our website, you can put in your zip code there and find practitioners, both pharmacists and doctors in your area. It's easy to approach pharmacists. You can find a compounding pharmacist in your area that works with bioidentical hormones and say, I want something to read about this, I want to learn more, I want to know what the symptoms are. Educate yourself is what I always tell patients. Educate yourself a little bit, and then work with this compounding pharmacist who can help you find a physician in the area. And what they'll do is measure your levels. Symptoms tell you there's a problem, but symptoms can't identify exactly which hormone it might be. In other words, a woman comes in, she's 47, she's having hot flashes, just mildly just started, a little bit irregular in her period, she's not sleeping quite as well and gained 5 pounds. Most people would say all she needs is progesterone. Well, she probably does, but it could be her progesterone's fine, her cortisol is just really high, causing the same symptoms. So we have to correlate the symptoms and what we suspect is a problem with your actual levels. And levels are real easy to take. You can take a saliva test at home, just collect your saliva in a tube in the morning, and if you're going to measure cortisol 3 other times during the day, comes in a postage-paid kit. You just send it in, boom. Your results are then available. Both they come to the patient, or the patient requests it. They'll also be available to the other health practitioners that they're working with. And then at that point, we can determine where there are deficiencies and imbalances, exactly what we're dealing with. Do we have adrenal issues, thyroid issues, insulin resistance, et cetera? And then address those issues that are most pressing first. I always tell people, we're not going to fix you overnight. It's not like take one test and we plug in the right amount of everything because everybody's a little bit different. But we're going to address each individual, their worst problems first, and fine-tune you over the next 6 months or so to see just how good we can get you to feel.
Right, exactly. You know, the one thing you mentioned there that's quite interesting, Jim, is that we seem to have this mindset that, you know, more is better. And when it comes to bioidentical hormone replacement therapy, is it possible to get anything over the counter where somebody would go into an area and say, okay, I heard this would be good for me, so I'm going to go ahead and take it home, and then before you know it, they're overdoing it?
Yeah, there is a problem, especially with the topical creams that you put on, because they can build up and accumulate over time. And you can balance, a woman can, for example, balance her estrogen and progesterone at a good physiological level, normal to what she would have had a few years ago, and feel great. She can balance estrogen and progesterone with both of them being very high and still feel okay symptom-wise. But the difference is when you get to super physiological, when they're too high, those benefits we talked about start reversing. Instead of helping maintain normal weight, too much estrogen or too much progesterone will cause insulin resistance. You lose your cardiovascular protection. You lose some of the, at least to some degree, you lose some of the nervous system protection, and you depress your immune function with too much progesterone. Too much progesterone, you need just the right amount of progesterone, a good amount for proper thyroid function, but if you get too much progesterone, you actually suppress thyroid function. So going too much actually long-term is not providing protection. That really is one of your basic goals. It's very hard to self-regulate because the symptoms of too little hormone are almost exactly the same as the symptoms of too much hormone. And it gets very complex, gets into the biochemistry and receptor response and all that. But many physicians aren't aware of that. Too much progesterone or too much estrogen looks just like too little estrogen. So oftentimes they just keep increasing the dose and get to the point where they're not going to make any progress. So I'm glad there's OTCs available, especially in the areas where there aren't doctors prescribing bioidenticals that we can use over-the-counter progesterone, but I often recommend that you go see a compounding pharmacist and tell them you need an OTC because you haven't found a doctor yet. Get a level first, make sure you need it, and then make sure you're using a good over-the-counter because there's not much regulation over-the-counter. There's some good products out there, don't get me wrong, but there's also some products out there that aren't worth a nickel. So you need to find somebody who's a compounding pharmacist who's familiar with what products are good and work, and not just buy one off the internet or off the shelf.
The reason I brought that up, Jim, is it seemed not too long ago as I'm driving around, I'm listening to the radio, and they brought up a commercial about bioidentical hormone replacement therapy, and the word risky was thrown in there as part of the commercial, of course, to steer you in a direction toward the product that wouldn't be so risky in the first place. And you take a look at how we get these messages that guide us into the decisions that we make and realize, as you said earlier, education is of a vital importance when you're ready to do something that, to me, is kind of serious business.
Well, it's a very critical first step. Both the physician, the pharmacist, who've been working on this for years, but most importantly, the patient, you need to educate yourself. Health professionals, in my mind, shouldn't be there to tell you what you have to do. They should be there to advise you on the wise choices to make based on their knowledge. So my job is to advise you what I feel you need to do, but I really like to empower the patient with knowledge for them to actually make the decision and make the lifestyle changes. I mean, it's your body.
Mm-hmm.
It's your life. You need to control this. Well, you can't make those decisions if you're not knowledgeable on it. So again, the first step, become more educated on this. You don't have to run in and do it overnight. Go in and see your compounding pharmacist in your area, get a good book on hormones and read that, then ask questions. Ask a lot of questions.
Now, if somebody gets to a point that they need to have bioidentical hormone replacement therapy, generally how long is it? Is it something that's ongoing, or what is the time frame typically?
Well, now this would be confusing because conventional therapy, doctors will tell you no more than 5 years. Well, that's because risk increased the longer you take conventional. But with bioidenticals, again, I'm just restoring it to provide not only symptom management, but protection. As far as symptom management, I could give you less and less hormone as you get older and take it away. Because if a woman does not restore hormones, most women in 5 to 7 years, the symptoms are alleviated. The hot flashes will go away eventually. Your memory may never be the same, but most of the symptoms will at least alleviate. So we could take the hormones away in that amount of years, not worry about the symptoms so much. But the moment I stop your bioidentical hormones, I am no longer providing you the cardiovascular protection. I'm no longer supporting your bones, your muscles, your teeth, your nervous system. So in my mind, as long as you want to provide those protections, you have to continue to take the hormones.
I'll tell you, it's just amazing to realize that we've turned, the direction that we have, where people are taking more responsibility for optimizing their health in a more natural, sustainable way, versus, here's a symptom, pop a pill, and let's just move forward. Jim, could you give out information for people listening to this program today, how they can find out more about this?
Well, I think a good source of information is our website. We've, in the last year, hired a new website master, whatever you call those guys, to put together, and the amount of information on there is just wonderful, salivatest.com. There's all kinds of reading on there. It talks about the symptoms. It's a good source of education. And like I say, the other source would be, you could go on there and put in your zip code under Find a Provider, and it'll list the doctors and pharmacists. I would look at the compounding pharmacists because they're very approachable, and most of them stock books on the subject. And you could just give them a call and ask them if they do bioidentical hormones. If so, can you get some recommended readings? Read what you want. You can read a book on general BHRT. If you think thyroid's your issue or cortisol is your issue, you can read books specifically on those. Much as you want to learn, there's some good information out there.
Very good. And quit taking information secondhand. It's funny how you'll hear people in a conversation, well, someone told me this, so I'm doing it.
Well, there's a lot of confusion out there, especially in this field, because unfortunately, this is one field where there's a lot of opposition by the drug manufacturers, because if bioidentical hormones catch on to where the science says they should, that's going to really hurt some bottom lines as far as drug manufacturers. So there's a big push to falsely accuse bioidentical hormones of not being any different, where the science is definitely clear there's a huge difference, much more beneficial, safer.
And that's what I was talking about earlier with the radio spot that I had heard, avoid risky bioidentical hormone replacement therapies, use this. And people will listen to that and not realize the bias sometimes and how that can drive them in a direction that can become very critical, actually.
Actually, yes. It can be very confusing. Again, the best way to do it is work with health professionals, pharmacists and practitioners who have already been doing bioidentical hormones for a while, or at least one of the two. We call it the triad. The patient's at the top of the triangle, and then down the other corners are your practitioner, your prescriber, whether it be a nurse practitioner or a doctor, whatever. The other corner is the pharmacist, and we're a team, and we're there to support the patient. Well, if you have a doctor who's not familiar with bioidentical, you get a pharmacist who is. You need at least one of those two health professionals to be familiar and experienced with bioidentical hormones. Then they can do them safely and not get you too much.
Well, very good, because more is not necessarily better. Just doing the right thing is. And, Jim, thank you for joining us here on the Beyond 50 radio program. Go ahead and give out your website again one more time.
www.salivatest.com.
Very good. Well, Jim Paletti, thank you for joining us here on the Beyond 50 radio program.
Dan.
You bet.
Thank you very much.
What a good time. You betcha.
All right.
Want to encourage you folks, that's what it's all about. That's what our radio program is all about. Get out there and get started with the right information to make better choices and ask better questions. Don't just read or listen to a radio spot or watch a television advertisement that tells you one way is risky when you can go and find out that for yourself. Be sure to also visit us at our website at beyond50radio.com and sign up for our free weekly e-newsletter. Also be sure to visit us at our blog. I'm Daniel Davis. Thank you for tuning in. You've been listening to the Beyond 50 radio program, and remember, live your day past halfway.